Welcome back to Ophthalmology for undergraduates and postgraduate beginners. In this video, we are going to discuss about the common questions that are asked in the examination about pterygium. The first question is pathogenesis of a pterygium. Pterygium is due to chronic exposure to dry heat, dust and ultraviolet rays. Chronic exposure of the conjunctiva to these things leads to chronic irritation of the conjunctiva. Chronic irritation leads to inflammatory cells accumulation in the conjunctiva and its layers. That will lead to a chronic inflammatory edema of the conjunctiva, which will be present there for a very long time, that leads to a reactive fibrovascular growth in the conjunctival portion. So this is the pathogenesis of the pterygium. The second commonest question asked is, why pterygium is seen in the interpalpebral region only? The pterygium is very common on either side of the cornea, only in the interpalpebral portion, because only these portions are maximally exposed to the ultraviolet rays and the dust particles. The portion which is above the cornea and below the cornea are not exposed to the ultraviolet rays and dust particles because they are covered by the lids. Another important question that is asked in the examination is, why pterygium is common on the nasal side? Most of the people who are suffering from this pterygium will have the pterygium only on the nasal aspect. Only very few will have pterygium on the temporal aspect or both nasal and temporal aspect. Let us see what is the reason. The first reason why the pterygium is common on the nasal aspect is, we all know that the major portion of the tear fluid is secreted by the lacrimal gland, which is on the supratemporal aspect. From here only the tear fluid is secreted into the conjunctival sac. So this tear fluid comes into the eye, and by the movements of the lid it is spread on the surface of the conjunctiva and cornea, and after lubricating the surface and washing away all the dust particles that is coming into the eye, the tear fluid reaches the medial part of the conjunctiva, that is the nasal portion of the bulbar conjunctiva. Here you will have a small swelling that is called as a caruncle, where the hair follicles will be there. So what will happen is, once the tear fluid with the dust particles they come here, the dust particles are attracted by this hair follicles and they join together and come out like a discharge. The water alone will flow through the lacrimal punctum into the lacrimal sac, into the lacrimal nose. So the maximum concentration of dust particles is on the nasal bulbar conjunctiva. So the maximum irritation will be present on the nasal bulbar conjunctiva. This is the first reason. The second reason for the pterygium to be common on the nasal side is, it is because of the excessive amount of ultraviolet rays received by the nasal part of the bulbar conjunctiva. How it happens? The ultraviolet rays is going to fall everywhere in our face. It is going to fall both on the nasal bulbar conjunctiva as well as temporal bulbar conjunctiva equally. But there is an additional load of ultraviolet rays that is falling on the nasal conjunctiva, that is being reflected. Suppose the ultraviolet rays are coming and falling on the nasal bridge here, that will be reflected towards the nasal bulbar conjunctiva. So apart from the direct ultraviolet rays that are falling on the bulbar conjunctiva, the ultraviolet rays reflected by the nose also falls on the nasal bulbar conjunctiva. So there is an excessive amount of ultraviolet rays that is getting concentrated on the nasal bulbar conjunctiva, causing it irritation and development of pterygium commonly on the nasal aspect. The third most commonest reason for development of pterygium on the nasal aspect is because the nasal bulbar conjunctiva is more hotter than the temporal bulbar conjunctiva. The person is exposed to a dry heat because nasal bulbar conjunctiva is in the enclosed portion. The heat is concentrated on that area. It does not easily get cooled down. But the heat that is falling on the temporal bulbar conjunctiva, because the temporal bulbar conjunctiva is on the sides, it easily gets cooled because of the movement of air in that portion. So pterygium is common on the nasal bulbar conjunctiva for three reasons: because of excessive dust concentration in the nasal portion, excessive UV rays falling in the nasal portion, and because of the excessive hotness or temperature in the nasal portion. Another commonest question that is being asked in the examination is how pterygium affects vision. It affects vision by three ways. One is causing astigmatism. When the pterygium encroaches into the cornea, the corneal shape or curvature is altered, leading to a irregular curvature of cornea, causing astigmatism. Astigmatism, as all we know, this is a refractory error that affects or decreases the vision. Pterygium can grossly reduce the vision by growing above the pupil so that the light rays entering into the eyes are totally stopped. This can lead to blindness in a patient. Pterygium, it not only grows into the cornea, it grows towards the canthus also. So when it grows that side, we know that there is a medial rectus insertion and lateral rectus insertion. It can infiltrate into the muscles, leading to improper functioning of the muscles that can affect movements of the eyes, causing diplopia. So this way pterygium affects vision. Because of this third reason, when we do a excision of pterygium, we should not excise beyond the insertion of the muscle. We have to cut the pterygium only up to the insertion of the muscle. If you cut it beyond the insertion of the muscle, sometimes you can injure the muscle, even that can cause permanent squint and diplopia to the patient. So we have to be very, very careful while excising the pterygium. You are not supposed to damage the medial rectus or lateral rectus muscle while doing a surgery. The fourth commonest question is, what is the differential diagnosis for pterygium? It is pseudopterygium. What is this pseudopterygium? Pseudopterygium is due to inflammatory disease of the conjunctiva. It can be a conjunctivitis where the conjunctiva is very much edematous and swollen, which we call it as chemosis. When you have a raw surface in the cornea, this swollen conjunctiva can get attached to the raw surface of the cornea, leading to a pterygium-like picture. But it is not a degenerative disease. It is because of the inflammation, there is attachment of the conjunctiva to the cornea. So that is called a pseudopterygium. Pseudopterygium, unlike pterygium, can occur all 360 degrees in the eye. Pterygium occurs only in the interpalpebral region, and apart from that, you can pass a probe below the pseudopterygium. You cannot pass a probe below a true pterygium. Another differential diagnosis for pterygium is pingicula. What is this pingicula? Pingicula is nothing but a yellowish color, triangular, small swelling that is present on the nasal bulbar conjunctiva or temporal bulbar conjunctiva. It will be triangular in shape with the base towards the cornea and apex towards the canthus. This is caused by hot, dry climate, ultraviolet rays and dust irritation similar to a pterygium. But here, similar to a pterygium, there will be a allostatic degeneration of the substantia propria of the conjunctiva, and there will be a amorphous hyaline deposition will be there. So there is no treatment needed for this, unlike the patient is having a cosmetic problem where we have to do an excision, or if the patient is having irritation because of the raised swelling causing dryness, we have to give tear substitutes. We have to ask the patient to wear goggles to protect from ultraviolet rays and dust particles. Another important question is, what is the complication of a pterygium? Pterygium can undergo a cystic degeneration. It can become infected and get inflamed, or it can rarely go in for a malignancy. So this is the complication of a pterygium. After an elaborate discussion of pterygium in the past 2 videos, I am stopping here. You have to watch these videos fully so that you can answer most of the questions in the examination, because pterygium is the commonest case that will be kept for all students. Thank you.